because of the lockdown, unless it's an emergency, no one wants to go to a healthcare facility fearing that they may catch the virus rather than vice versa. See, it is quite surprising for those of us in the healthcare industry when people are actually shocked when we say we are in as bad a situation as any other industry. Talking specifically of imaging and the pathology labs, the workload and consequently the daily collections are down by 90%. Our fixed costs remain more or less the same. And in labs, actually the fixed costs account for nearly 80-85% of all costs, and about 45% are just the salaries alone. There is a slight difference between the pathology labs and radiology and imaging, in that for imaging, a patient has to physically come to the department or to the center. So he has to physically be coming there, whereas in pathology, you can go to his home and take a sample. That's why you have these large chains which have 5,000 collection centers, and you just transport. Unfortunately, it's not possible to transport the patient. And that also there is this difference one needs to remember, and that will impact what happens as we go into the future. Even though it's the pathology labs and these 82 of those private labs and about 190 odd government labs, which are actually, in the face of things, trying to diagnose COVID, but the other tests have really fallen off. Most of the pathology labs, just as most of radiology diagnostic centers or centers which have a mix of both, most of them are closed currently, because what is the point in opening if you're going to have 5-7 patients walking in? Patients, one, because of the lockdown, two, because of the fact that unless it's an emergency, no one wants to go to a healthcare facility fearing that they may catch the virus rather than vice versa. So currently things are really bad. And somehow we managed to pay salaries for March, but for April, it's a struggle. How much can you borrow to pay money which will never be recouped? So across the industry, and this goes for the hospitals also.